Member for North Coast.
Honourable Speaker, Interior Health is transferring laundry services out of its hospitals. The Director of Support Services says the decision, quote, isn't about the efficiency of our operations. What he does say about it is that it's about not wanting to spend money on replacing old washing machines. Honourable Speaker, public or private, British Columbians will be paying for those washing machines. The issue is these jobs could end up leaving British Columbia. There is not a good reason to send these jobs to Alberta. Why is the Health Minister allowing this to happen?
Minister of Health.
Thank you, Honourable Speaker. Quite in a very concise way, I'll say they'd rather spend those on hip replacements than on washing machines.
Member for North Coast on a supplemental.
175 jobs could be lost in Kelowna, Kamloops, Nelson, Vernon, Penticton, and in the Caribou. And again, there's no guarantee that these good-paying, family-supporting jobs are going to stay within British Columbia. The Health Authority is following the mandate of the provincial government, whose preference is to privatize more and more aspects of the healthcare system. Considering that the Health Authority is clearly satisfied with the efficiency of the laundry services, why is the Liberal government insisting that they eliminate these good family-supporting jobs?
Minister of Health.
Thank you, Honourable Speaker. The health authorities and the ministry are very consistent. We want to get the very best deal for the taxpayer, Madam Speaker. That is very consistent. And quite frankly, Madam Speaker, doing laundry, washing bed sheets is not health care, Madam Speaker. We want to make sure we get best value for the dollar. I know the way the members opposite ran healthcare, they might have thought that was healthcare. We think healthcare is looking after patients to make sure they get their hip replacements in a more timely manner, Madam Speaker. We're going to get the best deal for the taxpayer, and laundry is not healthcare. We want to put those dollars in frontline healthcare for British Columbians.
Member for Nelson Creston.
Madam Speaker, only a Liberal would think that cleaning and taking care of our hospitals isn't health care. This plan would see 17 family-supporting jobs.
Members, the chair will hear the question and the answer.
Madam Speaker, this plan would see 17 family-supporting jobs lost in Nelson. Jobs that are integral to Kootenay Lake Hospital and it running efficiently. And it's not just Nelson, Madam Speaker. Penticton, the minister's own riding, Kamloops, 100 Mile House, Williams Lake, all are about to see family-supporting jobs shipped out of their communities. Minister, taxpayers are going to foot the bill for these services regardless of who's doing them. So let's do them in our communities, and let's save on the shipping costs. So my question is to the minister, will he commit to that today?
Minister of Health.
Thank you. Madam Speaker, I get the point, and I certainly don't want to leave the impression that the work being done by people that are doing laundry service isn't.
Members. Members. Minister. Member. Please continue.
Thank you, Madam Speaker. It's obviously an important service, but it is not frontline healthcare, Madam Speaker. And those jobs are going to be staying in British Columbia, Madam Speaker. We're looking for efficiencies. The members opposite talk about making sure that we are doing more with our dollars to make sure we get best value for the taxpayers. Madam Speaker, in healthcare, the only way we have managed to reduce the cost increases and make the healthcare system sustainable is to do things more efficiently.
Columbia River Yellowstone.
Thank you, Madam Speaker. The only way we can make the system sustainable is to increase efficiencies so that we can do more hip surgeries, we can do more knee replacements. Madam Speaker, the Interior Health Authority had discussions with their unionized employees about ways of reaching those efficiencies. Unfortunately, they could not come to an agreement, so they are going out to an RFP, request for solutions, actually, Madam Speaker, to see what the mix will be. But at the end of the day, the desire is to get the most for taxpayers so that money can be in frontline health care.
Thank you, Minister. Nelson Creston on a supplemental.
Thank you, Madam Speaker. Well, if the minister bothered to read any of the quotes, any of the newspapers that are about this very issue, he would know, and if he would listen to the questions, he would know that this is not a matter of efficiency. The Chief of Operating Services was clear that this is not a matter of efficiency. Rather, it's because they don't want to replace washing machines, Madam Speaker. Those washing machines, those jobs, those efficient jobs are wanted. Every single one of them, every 17 of them are wanted in Nelson at Kootenay Lake Hospital because cleaning the hospitals and taking care of the hospitals are important to the healthcare system. The same is said in Kelowna, Kamloops, in Vernon, Penticton, 100 Mile House, Williams Lake, Lillooet, Ashcroft. So the question to the minister, 175 jobs, Minister. Will you commit today that those family supporting jobs will stay put?
Yeah.
Minister of Health.
Thank you, Honourable Speaker. Madam Speaker, we have a record capital budget for healthcare. We've spent over $12 billion, including the capital cycle that we have in front of us, Madam Speaker, and yet every single day members opposite stand up and say spend more here, spend more there, build this, renew that. But Madam Speaker, Interior Health is doing that, making choices. And Interior Health is saying we would rather buy endoscopes, we would rather buy operating room lights, we would rather put our money into healthcare capital rather than buying washing machines, Madam Speaker. Only the NDP would choose washing machines over endoscopes.